offers. Call us now on 0208 808 8800 or email us at bentelevisionuk@gmail.com. We are here to serve you.
We're going to come really serious now. We're talking about sport. We're talking about healthiness, aren't we? We're talking about our hearts beating and pacing to run up and down on the tracks, aren't we? This is all about health, isn't it? So here's my segue right now. We're speaking to Dr. Phillip Abiola, GP and clinical cancer lead Newham. This campaign that we're all seeing on our screens, Be Clear with Cancer. Be clear on cancer. But now we're talking specifics here, because Dr. Abiola is joining us to talk about African and African Caribbeans, to be very clear on cancer. Before the break, sorry, I'm just going to quickly tell you this. I asked him, well, when I see the adverts, I never see a black person on it, but he's going to talk to us about all of this. Lovely to see you, and thank you ever so much for your busy schedule to come out and talk to us about this. Be clear on cancer.
Yeah.
We all have to be very clear on cancer. We've seen the adverts. We know that we have a cough. We know that we see blood in our urine. We have to do this and we have to do that. What is it specifically about the African Caribbean communities that we need to say to ourselves, be very clear on cancer?
Thanks, Pam. There's no doubt that cancer can affect anybody. Cancer is not discriminatory in terms of race, ethnicity, or religion. But what we do know that the outcomes of cancer is determined to a very large extent by how quickly people present when they have symptoms.
Yeah.
This particular campaign by Public Health England is aimed at Afro-Caribbeans and in particular for lung cancer and heart disease. So we're saying that if people have cough that is persistent for 3 weeks or above 3 weeks, or if they are breathless and unusually breathless, that is, things they do normally without effort is suddenly becoming an effort, that they should not assume it is nothing.
Yes.
They should not assume it is ordinary.
Yes.
And going back to your question, we know that on a general note, people from African and Caribbean origin usually present late for almost everything, but in particular cancer.
Yes.
And we do know that smoking
is one of the key.
Prevalence is slightly higher in people of Caribbean and African origin.
Yes.
And in fact, we do know that 25% of Caribbean men do smoke and 25% of Caribbean women smoke, which is higher than any other ethnic group. And it is not surprising that on general note, again, the life expectancy of people from Afro-Caribbean origin is far less when you compare with Caucasian neighbors and counterparts. So, in a nutshell, the campaign is about telling people, targeting Afro-Caribbean in particular, not to assume that their cough is ordinary.
Yes.
Not if they are unusually breathless.
Yes.
It could be, not every cough or breathlessness is due to cancer, but it could be due to cancer. It could be due to other chronic lung diseases, like what we call chronic bronchitis and the rest of it. And the campaign is telling people that you can save yourself of going to early grave if you present early, and then you can save your relatives of unnecessary grief.
Yes, yes, yes. You know, Dr. Abiola, in our community, the males in our community, and it is a long-running thing, They think they're superhuman, these males, these black males. They never really go to their GPs because they're all right. Yeah. But by the time they do go, it may be detrimental. But what is it that you can say to the young males, 25-year-olds, 30-year-olds, keep going, because that is something that's not been stigmatized with them. They've seen their father not go to the GP. They've seen their uncle not go to, you know, how do we change the younger one's point of view to start going to?
Well, we need to change it because the younger ones, they are in the position to change the status of the ethnic group.
Yes, that's right.
We are already associated with a lot of bad things, poorer outcomes when it comes to health, cancer, other long-term conditions.
Yeah.
Therefore, people should go away from the idea that they are wasting their GP's time.
That's the thing.
Or it doesn't matter.
Yeah.
We seem to have some
cultural... Or they're seen as weak. If
exactly.
I go to I'm weak. I'm not, you know, a strong man, and, you know.
What we say to people is, it's better to be safe than sorry. And I would rather you waste your GP's time than stay at home and go to early grave and give your relatives grief. So you are not wasting your GP's time.
Yes.
That is why GPs are still in business.
Exactly.
That's why doctors are there. That is what they are trained to do.
Yeah.
And it's so sad when you see the outcome of people not presenting early due to either cultural beliefs or religious belief, which is so prevalent in Afro-Caribbean groups, as you know. Yeah. We are very religious. Yes. We are very cultural. Yeah. We have habits which goes back to...
we got our own little remedies as well.
Exactly.
We think
exactly. But and you see the outcome. You'll be shocked that even in London, you see Africans, you see Caribbeans who have cancer, who have symptoms, and they stay at home or they talk of natural remedies or they go to church or mosque and say they are praying on it until things becomes irredeemable. Stage 4, last stage, worst stage, and then they now call the ambulance. Perhaps, I mean, let me give you a case of which is very sad. I mean, I saw a woman in her 40s. She saw, even though we are talking about lung, but this is just an example of the breast. And when I saw her, it's unbelievable that somebody could be in this country with that kind of breast and was kept in a church until she was almost dying. And when I saw her, and I explained that you can, even though still go to hospital, you won't believe. They only called the ambulance for her when she was about to die. And of course, she went to the hospital to die. And you were talking about young males. But I can tell you, even among Africans and Caribbeans, there is this idea that it is only males that get cancer of lung. But I can tell you, even within the past few months, I saw a Caribbean woman in her 40s who had cough for a long time and did not present. And by the time we diagnosed the cancer, I'm talking a few months ago, it was too late. And she's a woman. And perhaps I should mention, one of the things this campaign is targeting are especially people who smoke, which is the strongest risk factor for lung cancer. If you smoke, or if you have even smoked in the past, because this lady I'm talking of actually smoked, used to be an ex-smoker. So don't say I've given up smoking so I can't have cancer. In fact, because that's what she thought of. So it's quite important, especially if you are above 50, or you have smoked, or you are still smoking, or you are what we call passive smoker. You live with somebody who smokes, you associate with somebody who smokes. Then you should, if don't assume your cough is ordinary, it may not be ordinary. And especially for elderly people who may think, or who may devise coping mechanism and say, oh, I don't have to do anything. Oh, maybe I'm aging. Maybe it's because I'm getting older. Don't assume. If something you were doing before is now becoming an effort, you're getting breathless by climbing stairs, or even other symptoms, like suddenly you're getting unusually tired, you're having chest pain or shoulder pain, or you are coughing out phlegm with blood. Don't assume it is nothing. You need to see your GP. You need to go and see your doctor.
Immediately. Can I ask you a question? I thought, Dr. Abiola, and correct me if I'm wrong, I was told that if you gave up smoking, say you're 20, gave up smoking, by the time you're 30, your lungs are cleared. It takes 10 years for the lungs to clear. Is that correct or is that incorrect?
Yes, on a general note, if you give up smoking, by 10 years, you have done a lot of repair. But never say never. As long as you have been a smoker in the past,
might still.
You are still susceptible. And perhaps I should also mention that you can have lung cancer without ever being a smoker.
I know.
So don't. If you, for any reason, have a cough, 3 weeks or more, persistent, or you're having recurrent chest infection, it is pertinent, it is important that you go to your GP. There's no point assuming that it could not be cancer. That's why you have to be clear on cancer.
You have to be clear on
That's
cancer.
why the Public Health England is making this campaign. That's why they are targeting people they know that generally they present late to their to
and
their
the
doctors.
encouragement is basically to go to your GP.
You can never
do that.
You're not going to lose anything by doing that.
That's right. So be aware, be clear. Another thing I want to ask you as well, you know, our youngsters in the school educational system, is there enough information that is even coming up in the school system, telling the young ones even?
Yes, I think there is, and the Public Health England is doing a lot to encourage community participation. And that's why we are saying, even to the young ones, if you see your parents, if having coughing for more than 3 weeks, encourage him or her to go. If you see your friends, encourage him or her to go. So if you are a wife, encourage your husband. If you persistent cough, encourage him or to go. If you are a husband, you see your wife coughing for more than 3 weeks, encourage her to go. So young ones, you're right, and we realized that they could be agents of change.
Of course.
And they have a key role to play. And we should also help them, because we know that children of smokers are likely to pick up smoking themselves. So there are a lot of things to educate, and especially in the communities, and anybody who have influence in those communities, maybe in church, in mosque, in temple, in everywhere. If you know anybody having recurrent chest infection,
indeed,
it could be a serious lung disease, and that lung disease could be cancer.
Indeed.
So,
Dr. Abiola, let's take a break now, because I'm going to give out a number. We're going to open the phone lines after this break. Call in, talk to Dr. Abiola. He's there. He's all free. Talk to him, any worries, any issues that you have. 0208 808 0693. 0208 808 0693. Mark that number. Keep it there. We're going to go for a short break now. When we come back, speak to Dr. Abiola. Yep. See you in a couple of minutes.
On Ben TV, I've actually been on the channel, yeah.
Ben TV!
Bavidi Luxury Hotel, the newest home away from home in the Nigerian hospitality industry. 10 minutes only from the local and international airports. It's the perfect spot for your relaxation whenever you're in Lagos. 24-hour non-stop electricity, cozy and colorful rooms, Wi-Fi internet connection, and flat-screen cable television. Bavidi Luxury Hotel. Our exquisite restaurant and full bar are simply second to none in taste and style. Bavidi Luxury Hotel. We are located at the posh, serene neighborhood in the Keja Business District. Your satisfaction is our first concern, so we train our staff to be professional and personable. Bavidi Luxury Hotel, number 20 Moshood Abiola Crescent, Ikeja, Lagos. Telephone +234 1291 7929 +234 708 287 7512. Bavidi Luxury Hotel, the new home away from home.
Tune in to Free Voice Radio every Saturday from 10 a.m. to 11 a.m. with your girl Empress Sonia to hear all the latest amebo on everything Nigeria.
Okay, welcome back to Lifestyle with me, Pam Joseph. Phone lines are open now. You can talk to Dr. Abiola, 0208 808 0693, 0208 808 0693. We're talking about Be Clear Cancer, Be Clear Cancer. That's the campaign, and the Public Health England has pushed this out. I mean, we've been seeing this on our screens and, you know, in our homes for months and weeks about that. Be clear on cancer. A cough, urine, you see blood in your urine, things like that. Little things that you may think, oh, you know, be clear on cancer, go to your GP. The most important thing about it is go to your GP. This is what Dr. Abiola is saying. Go to your GP. That's what they're there for. Go, make an appointment, and let's get it checked. Let's go briefly again, Dr. Abiola, about that. The first, we have certain symptoms, coughing, breathlessness, urine in the blood in the urine. Let's talk about things that, even if that is slight, why you should go to your doctors.
Yeah, it's not just, especially for lung cancer, the most important, the commonest symptoms is cough. Especially more than 3 weeks that will not go. Then you can get breathless. Unusually, maybe things that you used to do before, like vacuuming the house, ironing, climbing stairs. All of a sudden, even walking on the ground level, suddenly becoming an effort.
Yeah.
It can be persistent chest pain, or even shoulder pain, or even back pain, or if you having, like I said earlier, that you're coughing and you're bringing up phlegm, that is blood tinged.
Yes.
That is, you have blood in your phlegm.
Yes,
that could be a very
positive sign.
Positive, very important symptom.
Yeah.
So all those symptoms, don't sit on them. And it may look as if we are overemphasizing it, but we've seen cases of people having all these things, and they think it doesn't matter. It does matter. You may be wondering, why is shoulder pain important? Why is chest pain important? Because we do know if people have lung cancer, a lot of times, especially if it's so long, they subdivide it. They could have spread into the bones,
Of course.
which will cause bone pain.
Yeah.
But what I say to people is, even if it is late, things have got so better in terms of treatment that something could still be done. I mean, we had somebody, I think about 5 years ago, who we gave him about months to live. And 5 years it was still because treatment has improved.
Yes, the treatment has improved.
Treatment has
Can we
improved.
talk a bit about that,
Yeah.
Dr. Abiola, the treatment? Because we hear about, you know, the laser, the beam. I can't remember what you call it now.
Yeah, radiotherapy.
Radiotherapy.
Yeah.
And shaving off one's hair and all this lot. What sort of improvement are we talking about here?
Yeah, we're talking of very marked improvement. And that's why about 10 to 15 years that I've been involved in cancer care, it used to be about looking after patients with cancer on how they would die.
Yeah.
But now we're talking of how to look after
live.
them, having survived cancer.
Yeah.
We're talking of
live for it, yeah.
post-survivor,
Yes, yes, yes.
because a lot of people are surviving cancer.
That's right.
And the reason is because a lot of people are presenting early. Like even the guy I mentioned just a while ago came because of a campaign like this. He was a smoker, and he had that, if you cough for 3 weeks, you should go to your GP. That's why he came.
Right on.
Even though we thought it was late, but 5 years after, he was still living. Because treatment have improved.
Yes, yeah.
We now have loads of new treatment, and that's why cancer is gradually becoming one of the conditions we call long-term condition.
Yes,
That is, things that will kill before, but now they are becoming things people live with.
Yes, yes, yeah.
Just, I mean, I don't know if you still remember when HIV just
Yeah, of course.
and
and
AIDS.
everybody, yeah.
When you had, when people used to hear about it, it used to be death sentence.
Yeah.
Cancer is no more death sentence, especially if people present early. And that's why one of the principal aims of this campaign is for people to present early.
Yes.
Is for people to go to their GPs if they are having cough that will not resolve.
Yeah.
If they are having recurrent chest infection, if they are getting breathless, and not only could it be lung disease, it could be heart disease,
Yeah, it could, yes.
which is also common in in Afro-Caribbeans and Asians.
Yeah, yeah. We need a sort of website also, as we're talking here, for people to perhaps say, well, let me get more information if I can sit at home and just sit down there and read up on the main symptoms. There's a website, a national website that they can go to?
Yeah, if they just go online and just put "Be Clear on Cancer," there are loads of information.
Yes.
Just put "Be Clear on Cancer," Google or any online website.
Cancer,
just put "Be Clear on Cancer."
Yes, yeah.
It will take you straight to the Public Health England website.
This is the first time the Public Health England has launched this.
It's not the first time. Like I said, even they did one 5 years ago, and I saw a patient who gave himself a chance because he responded to this kind of campaign.
Yes, yeah.
And he said, I heard that if I've been coughing for 3 weeks, and I've been coughing for more than 3 weeks.
Yes, so that one 5 years ago worked.
And he got cancer, and even though it was late, but it helped him.
Oh, maybe I should say it's the first time the Public Health launched a national campaign on specifically lung cancer and lung disease and heart disease.
And
that's
targeting
African Caribbeans. Yeah. Okay. This is good. Now, there's been a new film that's been released.
Yes.
And it encourages anyone with persistent cough to say. Now, this film is aimed at African Caribbeans. I've not seen this film. Where am I going to see this film?
Well, I think even online, I think it's there. It's online. And if you look at, apart from the electronic media, which they're using, as we are doing now, if you look, I think yesterday's Voice
Yes, newspaper.
is there.
Yes.
And and I think it's lots of information.
Yeah, right.
That you will say.
Because you know what you said. You started off saying to me, cancer does not discriminate.
Yeah.
Cancer goes through your race, your age, and what have you.
Yeah.
But then you started talking more specifically about African Caribbeans.
Yeah.
And then you started saying to me as if we were the ones that seemed to be...
To present late.
Because we present late.
Yeah.
Okay.
Because we present late.
Because we present late.
We present late.
Right.
We smoke more.
Yeah. And we present late.
We present late. And that is the key thing.
That's the key.
And that's the aim of this campaign, is to tell people to be aware that they we shouldn't sit at home. We shouldn't use religious reason. I believe in divine healing. But God made every knowledge possible. It is, why would God invest in people like me if my knowledge would not be useful?
For real, you know. Yes,
exactly.
for real.
So people should not say, oh, because I believe in God and I believe God will heal me, I won't go to doctor. God asked us to dominate everything He created, including knowledge. So, because one of the things that affect Afro-Caribbean, people from Africa and Caribbean, is this ignorance that, oh, because I believe in God,
I'll be all right.
I believe in God. God may heal you divinely by using doctors for you.
Yes, that's right.
So, so we should not be ignorant.
Exactly.
We should not be ignorant. God made the knowledge possible. Even as a doctor, I believe there is no knowledge that man can claim any credit to without it being made possible by God.
For real.
So
Never said.
We can't use that.
Do you know what? We didn't get any callers. You know, everybody's obviously all right. It would seem, or maybe Dr. Abiola explained enough for you. He answered your questions without you asking him a question, so that's fine. But you know, just for out of curiosity, and maybe they want to know a bit more about you, Dr. Abiola, can anyone who wants to know a bit more about you and your practice and whatever, can you give out any information for us? Your website, what have you?
Well, for this campaign in particular, we will rather restrict it on to if they go on the Be Clear on Cancer. As you know, I'm always coming to this station, and then I can give personal information. But people know how to get me on live. If they want to bet, I'm sure I will come back. But on this occasion, we want to focus people on Be Clear on Cancer. And if they Google that, if they put it online, I can bet you they will have every information that they need.
Yeah. Okay. And that's what we all have to be clear on cancer.
Be clear on cancer. Go early, don't delay, don't assume.
Yeah.
Cancer is no more death sentence. Could be treatable.
You can survive with it. Yeah.
Don't use any cultural or religious belief. Don't let it stop you from making use of what God has provided.
Yeah.
And if you tell your parents, if you see your neighbors, if you see your friend, if you see your wife, your husband, having cough more than 3 weeks, getting breathless unusually, getting tired unusually, having any of the symptoms we've listed, they're not going to lose anything.
That's
you
right.
cannot lose anything by going to
but
your
doctor.
You can gain
more
everything,
easier.
and it's always better to be safe
than to be sorry.
Dr.
Phillip Abiola, you know when I walk down the stairs just now, if I'm going to be breathless, I'm going to go straight to my GP. Thank you ever so much.
It's always a pleasure.
So much.
It's a pleasure.
Be clear on cancer. That is the key. Go to your GP, please. We want to keep you here as long as possible. Right, we're going to go for another break now. Well, maybe have a nice, healthy glass of water. before we come back. See you soon.